Good morning. So we are going to start our next session where Dr. Swathi Naga, she's going to be speaking about lactation equipments. And she's a lactation professional who's also a women's health physiotherapist. She's CAPA certified and IYCF certified and has interest in antenatal and postnatal counseling and human milk banking and lactation management. Dr. Swathi, please go ahead.
Yeah, hi. Good morning, everybody. Today the topic is empowering mothers with lactation equipment. Lactation, breastfeeding is a natural right where every mother deserves to make informed choices regarding the breastfeeding with the necessary resources and the support. Where there many challenges exist, many women face the physical, emotional, and the societal challenges about breastfeeding. Empowering the women, the mothers with the breastfeeding, ensure that they overcome the hurdles confidently, where we will get a healthy outcome of both baby and the mother. Coming to the lactation equipments, the lactation equipments, breastfeeding trackers. Breastfeeding trackers help the newborn mothers and parents to track, monitor, and manage the breastfeeding schedule, help them monitoring the feeding time, duration, and the side of the feeding for the next feed. They also give the monitoring of the baby growth, next pediatrician visits, and the feeding patterns. The additional features which help in the apps are sleeping patterns, diaper changes, and the pumping sessions as well. So here are the few apps: Baby Tracker Newborn Log, Baby Day Book Newborn, Parent Love Baby Trackers. Next, the breastfeeding bras, which help mothers, gives the comfort and the convenience for the mother. And we need to choose the mother has to choose whether it's a very fit and comfortable for the mother for the feeding, the smoother and the comfortable fabrics for the feeding, and it should be easy for the putting it on and taking it off after and before the feeds. Next, the breastfeeding pillows. These pillows give comfort and support for both baby and the mother, which helps the mother to comfortably sit so that mother can give the feeding for the long times, and further feeds will be comfortable as for the baby and the mother. Positioning of the baby is also important while feeding. That gives proper latching for the baby. So mother needs to sit comfortably, only then take the baby for feeding. Next, coming to the baby position. Baby should be properly positioned so that there will be a better latch without any sore nipples or the flat nipples coming forward. Then see, the baby position should, though you use the pillows for the feeding, there should be a mother and baby bonding. So mother should still hold the baby. There should be a contact between mother and the baby, though you use the pillows. The breastfeeding is always taking the baby to the breast, not breast to the baby. So accordingly, use the pillows before feeding. Massager, which relieves the engorgement, the clogged ducts, that helps in sore and tender breast, stimulate milk, so that relieves pressure and prevent mastitis. Hydrogel pads, there are hot and cold. The hot relieves the pain and the engorged breasts and the blocked ducts. The cold therapy soothes and reduces the swelling, and that gives immediate relief, instant cooling, and the pain relief for sore or cracked nipples. There are different sizes and shapes of the hot and cold therapy pads. You can use accordingly. The next one is the nipple cream. The best nipple cream is the breast milk itself. The foremilk and hindmilk can be applied on the areola or over the nipple and the areola. That gives relief. Other than that, there are many nipple creams that elevate the pain, helps healing the damaged skin. So every feed, before and after feed, the nipple creams or the breast milk should be applied. Need not wipe it for the every feed. That's completely safe for the babies. Next, the breastfeeding pads or the nursing pads, they are worn inside the bra to absorb the leaking breast milk. There are types of breastfeeding pads: reusable pads, disposable, and the silicone breast pads. The disposable pads is convenient and hygienic. Reusable pads are cost effective and eco-friendly. They give comfort, reduce the risk and irritation of the infection. They needs to be changed properly and hygiene should be maintained before using the breastfeeding pads or nursing pads. These are types of reusable and the disposable breast pads. Next, the breast shells. These are very hollow discs that are worn inside the same breastfeeding bras that help to store the leaking milk. They protect the nipples rubbing against the clothing, and they give ventilation, helps healing the skin, helps healing the sore nipples or the cracked nipples. These all should be maintained the hygiene. These are the breast shells that worn. Next, the breast pumps. There are types of breast pumps, manual, electrical, double breast pumps, and the variable breast pumps. They help in expressing the breast milk and storing the breast milk. And this manual, every feed, every pumping, before and after pumping, these bottles need to be washed and sterile before and after the pump. The manual pump should be manually pumped, and the electrical ones are used. There are stimulation and expressions levels in the electrical pump. The wearable pumps are hand-free pumps worn inside the breastfeeding bras. The milk storage bags, the expressed milk can be stored in the bottles either or in the milk storage bags. The storage bags are more convenient compared to the bottles. The convenience and use, it's convenient for easy to use and store. So the milk storage bags are pre-sterilized compared to the bottles. Those are designed to lay flat while storing, leak-proof, double zipper seals, and the durable materials. Whenever you store the expressed milk, you need to label date and time on the bottle or on the bags. These are different sizes and shapes of the bottles or the bags for the expressed milk to store. Cooling bags, this expressed milk can be stored in the refrigerator, but when you travel, you need to take care that expressed milk need to be stored in a safe and cool temperature, easy to carry. Bottle washing brushes, when you express the milk in the store in the bottles, you need to wash it before and after the expression. So there are breastfeeding bottle brushes used to reach all the hooks and cranes of the bottle, needs to be maintained very hygienically. So you need to regularly bottle wash and maintain the hygiene. Sterilizers, there are different types of sterilizers which kill the bacteria and germs, both for the bottles and the toys of the babies. Electrical steam sterilizers, microwave steam sterilizers, UV sterilizers, and the cold water sterilizers. Nipple pullers, the inverted or the flat nipples, there is little difficulty in the latching. So the nipple pullers which are used to pull the nipple protruding out, pulling it out before feeding. There are types of nipple pullers, manual, vacuum assisted, and the syringe based nipple pullers. The benefits of nipple pullers, as the nipple, it's easy for the baby to latch on and breastfeed. So it improves the breastfeeding success rate, reduce the nipple discomfort, confidence in the breastfeeding of the mother, increase the milk intake, less frustration of the baby, so there will be a healthy baby taking good feeds. And side effects of this and the alternate solutions for this are the using of nipple shields. Nipple shields are very thin silicone sheets worn over the nipple on the breast. That's easy for the baby to latch on. Where if there is any sore or the inverted nipples, though you use the nipple shields, baby should latch on the shield, onto the shield and suck. If otherwise there is no use of taking the nipple shields, baby should latch on to the shield, not on the crown of the nipple shield. And weaning of the nipple shields is also important. You need to alternately give every feeds without the nipple shield, so that baby will be weaning off the nipple shields. Thank you.
Thanks a lot, Dr. Swathi. I think it's important for all of us to know at least how many gizmos or technologies are available. But I also feel that the core of breastfeeding is still skills, right? Breastfeeding skills, and being a developing country like India, a lot of low-cost, local, home-based technologies are also available. So while for developing lactation professionals here, it's nice to know that all of this is available. but I think we can also use the local stuff that we already have been using since a long time. So thanks a lot for still sharing all of these things with us. Thank you.
I think some of the new age mothers do require this kind of equipment because they will be encouraged to use like cooler bags kind of thing or pumping bags. They will be encouraged to continue their breastfeeding when they start working or going to offices or something like that. Thank you, Swathi.
Thank you, Dr. Swathi. I would like to also thank the moderators, Dr. Taro Jindal and Ms. Archana. Thank you so much.